1, and we're now live. TikTok live number 67. Guys, the top 5 listeners who stay on the longest on the live chat right now, going to be giving you guys a shout out in the caption on YouTube and podcast platforms. All right, let's get going. First question is asked by Strictly Baited. Thoughts on pediatric dentist career? I think it's great. Look, if you can work with kids screaming and work with parents at the same time, a lot of times, you got to consider that. That's a lot. For me, that's a lot. I work with parents and everything all the time. I work with kids actually quite frequently since our practice takes a lot of insurances and ton of kids last week. But I don't know if I'd want to be working with kids every single patient in and out. Now, also the collections is pretty substantial. If you look at what the insurance companies, what's billed out to them, the production, if you look at how much is reimbursed for the procedures that I've done, it's pretty close to 100%. It's like they get up to very close because insurance companies, from what I've seen and what I'm hearing from pediatric dentists and stuff, is that they generally reimburse really well, for those treatment plans. And it's not like that with old dentistry, right? But yeah, working with kids, screaming in your ear, moving, the parent getting all concerned, like, oh, no, why are you doing that? Why are you doing this? When you need to be careful to make sure that the kid doesn't get hurt and that you don't get hurt. There's a lot going on with kids, okay? So pediatric dentistry, hey, it's great. It's a great job, I don't know if I would be able to do that. I'm in oral surgery now, so I don't need to worry about that. I treat kids all the time. I'm not worried about that. But like, imagine every single patient screaming in your ear day in, day out. My left ear already kind of rings a little bit. K-Palm said, LOL. What's up, K-Palm? Megan said, I had my wisdom teeth out in the OR, took part of my jaw. Infection ate my jaw, ? That's osteomyelitis. That's when the infection can kind of spread to the jaw area. You're saying that took part of your jaw out during the wisdom tooth removal? Interesting. I mean, sometimes, like, for example, a maxillary wisdom tooth all the way in the back there, you might take out the tuberosity. The tuberosity is just the bone of the maxilla behind it, where a big chunk of that maxilla is just holding on to like a little bit of other parts of the maxilla and that tooth. So it is quite common for like tuberosities to come out, and unfortunately with wisdom teeth, maxillary wisdom teeth, especially if they're like old, they're ankylosed, they're in strong bone. Yeah, that's one of the things that can happen, and we try not to let it happen. Elevation, periosteal stuff, but it can. DDS, hey doc, can you place an immediate if a patient has periapical pathology? Now it depends. How big is that periapical pathology? How much bone is left with that periapical pathology? Is the periapical pathology involving an acute infection? Probably not a good idea to place an implant into that. So it really depends. Otherwise, if it's small periapical pathology, you have plenty of bone to get primary stability with that implant, or even second, like you will get primary stability. You get 4 walls placed around that implant. It's probably going to heal. So it depends. You see what I'm saying? Strictly Baited said, thanks, man. You got it, Strictly Baited. Yeah, thanks for hanging out today. Tori said, is periodontology a decent choice that pays off or not? I think so. I think it does pay off very well. Periodontists, they do very well. Yeah. Sometimes you have to run around to different dentist's office, and that could be a lot. But generally, I think perios, they do well. Eaton Cheeks _Cheeks said, how no? Tell us about the wisdom teeth story. What wisdom teeth story? Which one? What are you talking about? Oh, my buddy that I graduated with went out on the boat with my dad today, and he just sent me a picture in the background of the fish they caught. They must have had a great day. I couldn't go. I was in the city. I was in the city up until I got home at like 2:00. I wasn't going to be able to make it. But Hattori said, is periodontology a decent choice compared to OMFS? It's so different. It's different. Now, a lot of the surgeries and procedures we do are quite similar, right? Periodontics is, now remember though, what's interesting about periodontics is that, it's based off of the word periodontium, which is literally the specialty was created to save the teeth. And now a lot of the periodontists, they do implants, they take out the tooth and they put the implant in. And oral surgeons do implants too. So do general dentists, right? That's not what I'm saying. But it's funny how so many periodontists resort to just like implants now, when it's like your specialty is literally about saving the teeth by the periodontium. Periodontium is made up of the root, the cementum of the root, the surrounding alveolar bone, and some of the gingiva, and the attachment there. There's 3 to 5 structures that make up the periodontium. But so they're both good. They're both very good, but they do different things. Okay. And remember, in oral surgery, when things go wrong in any of dentistry, where do they end up? They generally end up at the oral surgery. Like when things really go wrong, they end up at the oral surgery, right? So that's something, and we know how to handle those complications. Ari.Laz said, any advice for general practitioner wanting to place implants in practice? Learn how to manage the complications. You guys, as dentists, we can do anything as long as we understand how to manage all and every complication that can occur from that procedure, right? So with dental implants, you need to know how to prevent things from happening, like going into the nerve, you don't want to put that implant into the nerve, right? That's really bad. That's a lawsuit. That can potentially be a lawsuit. And I don't want to see that happen to you. But yeah, if you can handle every complications and prevent certain complications from happening, then yeah, you should be able to do that and handle it. Make sense? Prit Patel said, how much do undergraduate grades play a role in OMFS residency? Sometimes the 6-year OMFS residencies, the ones that go do 2 years in medical school, sometimes the medical school wants to see your undergraduate grades. Does that make sense? When they have your dental school grades, I don't think it makes sense. But look, I don't make the rules. These medical schools, they do what they want, and it's fine. User 69 said, where you go for undergrad matter when applying to dental school? Unfortunately, it does factor in. You know, the prestige of your school it can and will be taken into account by many of the undergrad, the dental school counselors, you know, the dental school admissions office these years. I've seen it myself. So it's something to keep in mind, right? But if you have really good grades, you have a really good DAT score, you do have a good shot. You have a good shot no matter what school you get into, okay? Yasmin said, do you watch football? I don't watch football as much as I like. I work too much, you know? Like right now, I just got home an hour ago. We'll put the laundry in, organize my stuff, and I'm on the TikTok. Let's get this going, you know? But why? What's up, Yasmin? What do you think? Hattori said, thanks a lot, doctor. You got it, Hattori. Only workouts 1, 2, 3, said at user 69. FunnyClipz, do you think implant certificate residency is worth it? I don't know. I didn't do it, but you know, like what's that all about? The implant certificate? Like why don't you do a residency in periodontics or in oral surgery? You know, I don't know. I think it's cutting corners. I think it's cutting corners, and I understand the need for it, but like, I don't know. Are they teaching how to manage all the complications with implants? But then that's just taking it from periodontists and oral surgeons and other general dentists that can do it. I don't know, man. Dentistry is getting very different from, I don't know what. Dentistry is getting very different from what it was when I went into it 10 years ago. It's all about just placing implants, right? Because that's pretty much the only. It's hard because you can't blame people for that. It's the only thing that you make money on these days. You don't make money on 2 surface fillings anymore. The insurance companies, they don't reimburse anything. I mean, this Fidelis insurance, they're reimbursing $76.50 for a 1-tooth extraction. Some of these extractions, they take a while. They're surgical extractions. That's a $500 expense, and they're paying $76 for. Why are we paying less than it cost to do that in 1970? You got to be kidding me. That's what's going on. And poor patients, they don't understand. They see that it's, my insurance is full coverage, and then they go to the dentist, and I try to educate them. Like, look, your full coverage is $76. It's going to take me $500 of time to take this out sometimes. You know, I'm not trying to be a sleazebag. I'm not trying to, you know, I'm not a salesman. You know, I want to tell patients what they need, why they need it, and how I can help. But we need to make sure that people understand that these insurance companies are not there to help them. When they tell you have full coverage, understand what full coverage means. You know. Anyway, insurance companies. These insurance companies they're killing dentistry. They really are. Yasmin said, "Do you think Luca should aim for a 4-point conversion for his next field goal?" I'm sorry, Yasmin. I don't have the TV on in the background or anything. I gotta go wash the truck after this because bird poop got all over it when I kept it in the garage this weekend at my future sister-in-law and brother-in-law's place. We had a great weekend, but there was a little bird thing. I don't know. Bird pooped all over the car. I gotta go wash that off before my dad sees it and gets pissed. Telling you how it is, you know. Strictly Beta, do you still know how to prep a crown? Yeah, I can prep a crown. Yeah, do I want to? I mean, I did like it in dental school. I don't want to do it now, though. Let me take that tooth out. Only if it needs to come out. FunnyClipz said, do you feel like dental school would be the new hygiene with how easy admissions is and how many schools there are opening up? Yeah, it's interesting because the profession's consolidating, guys. There are more dental schools opening up, but they're not, it's not like there are more, I don't know, the jobs aren't necessarily opening up and coming more and more and more. And there is a bigger influx of dentists trying to come into the country and work, which is fine. You know, everyone wants access and opportunity, but it's because, let me put it this way, they're not opening dental schools to increase the workforce. They're opening up dental schools because there's more of an incentive to make money off of dental students nowadays than there is to make money by teaching people how to do patient care, how to treat patients for their dental needs. And it's sick. It makes me sick to my stomach to think about this. And you know what? The ADA is looking, they're so distracted by trying to get fluoride back in the water. It's like, look at what's going on in the profession, but they're very politically oriented. I was just talking with a dentist in the ADA, and she's like, they're so distracted. We can't implement things to make the profession better, to help students have a better experience, to help residents have a better experience, to help dentists have a better experience, more support for providers. They're very distracted. And if someone thinks otherwise, I'd be more than happy. Let's hop on a meeting. Let's hop on a call. Let's talk about this. prove me I'm wrong, and see if there's any way I can help with this stuff, right? Because we want to see dentistry going in a better direction, not just following the medical side of healthcare, where it's all about pushing all like patients to the hospital setting under hospitals, right? Because now hospitals are buying up all the smaller hospitals in outpatient setting, right? So now it's all about just getting the patient to there because they could keep everything in the system. Yeah, I really want to see this profession get better. And, I'm just starting out. I already have a lot of ideas and I'm ready to work. Let's go. FunnyClipz, do you feel like dental school will be we just did this. DJ Hay said, are pass-fail dental schools better for getting into OMFS residency than schools with GPAs? It depends on the school. A lot of them, like Ivy League dental schools, you see a lot of these pass-fail schools. And I think pass-fail schools generally have a better camaraderie. They have a better culture in that dental school, right? Because it is pass-fail. And they do require students to learn the material generally. So, but yeah, like Ivy League school, but that's the Ivy League school that gets really good matches into residency. Does that make sense? It's not necessarily because it's pass-fail. So I wouldn't phrase it that pass-fail dental schools place and match into better, more into OMFS residencies. I call it, depends on the school, right? That definitely makes sense, right? Lowly DKTBH, love your content. Keep going, brother. Love it. Thanks, friend. Thanks, my friend. Jfcjdbddj, just saw the latest dental malpractice video you posted. Great vid. Thanks, man. Thank you. Thanks so much. Thank you. Dude, that means a lot to me. More than you know, really. Yeah, that's the third case. We're doing these cases, these episodes. I'm doing an episode series. It's with MedPro Dental Group, right? So they do disability insurance. They do malpractice insurance. That's a different kind of insurance that I'm talking about. The insurance companies that I'm talking about are the ones that reimburse patient care. Those are the ones that have big red flags, big no-nos. I'm really against them. MedPro's a great insurance company, okay? In fact, for dentists, first year out, I think it's like $50 for their first year out. And then second year out, I think it's like 50% off or it's free and then $50 and then something. I forget offhand, but yeah, MedPro Dental Group. I've been following them. They helped me get my disability malpractice insurance when I went to externships during dental school. So that was 5 years ago. And they did a really good job with that. They have, his name's Cam. I forget Cam's last name, but yeah, I'm giving him a little shout out on the podcast. He's great of MedPro Dental Group. I hope they see this podcast because I really like working with them. I'm just working with them to try and get the posting time because we literally recorded that podcast a month and 2 days ago. I think it was the 12th of August. So now we're already in September posting one for them. I'm just working on so we can work on making the edits to get it out faster because guys, this insight, this is the whole point of what I'm getting to, this insight of let's review malpractice cases to make sure you know how to prevent this from happening to you. How do we maximize your safety when you're doing, say, sedations as an oral surgeon, or when you're treating this patient and accidentally remove the wrong tooth or what have you, right? Does that make sense? I think by learning from other people's mistakes on these case presentations that we're doing, and we're going through and what went wrong, how to prevent things from happening. What better to do? What is better out there than learning from others' mistakes so that you don't have it happen to you? So I really appreciate, partnering and collaborating with MedPro Group on this episode series. And I hope that we continue to do it going forward because I really love the guys, Dr. Leffler, Mark Leffler. He's an oral surgeon and he was attorney. Now, I don't know if he does litigation as much, but he is a big support and big power for MedPro Group. And he's so awesome. You guys watch the podcast. He's been excellent to chat with on these cases and his insight. Guys, he's an oral surgeon. I'm an oral surgeon now, young. I have so much to learn from him. You see what I mean? So, yeah. Hey, Jfcjd, thanks so much for listening to that podcast. I want you to know that really means a lot to me. Yeah. Shark Attack said, where'd you go to dental school? I went to Stony Brook. It's out on Long Island in New York. And what was your top choice dental school? That was my top choice dental school. Let's see, I applied to 5 or 6 schools. Stony Brook, NYU, Buffalo, Toro, Rutgers, and I applied to Florida because I have family down there. I did not get an interview at Florida. That's like 97% in state when I was applying, at least, that they keep in state. And so I didn't get an interview there. I got interviews at all the other 5 spots. And I got acceptance letters to all 5 spots. I picked Stony Brook. Stony Brook's it's a state school. It's got a small class size, so excellent one-on-one attention with clinic faculty, which is great to become a dentist. You literally need that. You need a lot of attention to learn hands-on skills as a dentist. I think we should be doing more of that. In fact, I think the DAT should reincorporate hand skills on it rather than adding in this physics that they're trying to do now because so many people are getting great scores. I think it's a really bad idea, but I don't know. What are you going to do? You got people, forget it, We need to make this profession better, and I understand that they're adding on set. We need to add on better hand skills. You need to have good hand skills in like 9 out of 10 specialties as dentists. You know what I mean? So anyway, yeah. Bree said, hey Bree, what's going on, Bree? Bree gave the heart. I'll give the heart back. What's up, Bree? How we doing? Jfcjd said, where'd it go? JFCJD said, how has work been? Oh, dude, work's been great. It's actually cool. I use this A app called Care Notes, and it helps me formulate everything. It listens to me when I speak to patients, and it formulates kind of like a clinic note. And I changed it where it's got another AI model where you can tell it what you want it to do. And I have it separate into bullet points of like medical history, previous surgical history, allergies to medications. And it helps because then you go see 9 more patients before you get to sit down and write the note. And you start to forget things the more other patients you see and the longer it's been. So that's Care Notes AI that I'm liking it. I'm really liking it. I want to see what I could do as far as helping the market themselves. You know what I mean? So that's been a huge help staying on top of patients and keeping the clinic going. JFCJD said, when you hear back from interviews from the different dental schools when you applied, a lot of them came in October. Okay, a lot of them came in October, some in November, if I remember correctly. So it's between September and November when you'll get a lot of hearing back from interviews. But guys, it goes on until like March. And I know people that had interviews like in the summer and got in the summer before, like a week before they started. I'm not kidding. So don't stress about it too much. You know, be aware of what's going on, of your possibilities. And like if you're on the waiting list, trying to ask where you're on the waiting list, you really want to go there and whatnot, you know. Lilia Dauto, how much time is it considered not normal to feel pain and sensitivity after a cavity filling? It's different for everyone. It depends on your personal sensitivity and healing. It depends on what procedure you had done. It depends on how big the cavity was. You see what I mean? There's so many things. It depends on what, with the cavity filling, did you do a root canal as well? Did you get a crown? How big was this cavity? How big was the filling? See what I mean? There's so many things. And then sometimes, unfortunately, with a little bit, it could be 1/10 of a millimeter. If that filling is a little too high and you're hitting, it's when you chew, it's hitting that tooth differently, the sensitivity might not ever go away until it's shaved down a little bit more to match. You see what I'm saying? So it's really variable. Victor Naisberg said, what were your grades like in undergrad? All A's and B's. That was it. That was my thing. In undergrad and dental school, all A's and B's. That was my thing. I wanted to get only A's and B's, predominantly more A's, right? You want to have mostly A's. But I didn't get myself into a bind if I got a B, okay? You're going to be fine. You need to figure out what differentiates yourself in character, work ethic, personality than other applicants. Okay. So that's something to really keep in the back of your mind, Victor. When you're going through undergrad, stick to A's and B's, try and get as many A's as possible. Remember, your DAT is going to be that playing field leveler with all the other applicants in the country. So that's something you want to think about. The TikTok dentist said, I'm seeing the DEI watering down of dental schools where procedures are being done on typodonts. What? I'm not following. I don't understand what procedures are being done. And the TikTok dentist said that isn't good. I'm sorry. Can you rephrase that a little bit? I'm not following. I'm sorry about that. But yeah, the dental schools are just increasing class size, but not increasing patient care because there's no financial incentive for patient care, unfortunately. And I am not saying we should be making money off people. That is not what I'm saying. I'm saying we need to incentivize patient care. People need dentistry. People need to go to the dentist to get that dental work. But insurance is stopping people from getting the care they need. Okay. And it's stopping providers from treating more patients. It's getting to the point where people are eliminating you taking insurance companies, as they should, because these insurance companies aren't reimbursing what treatments cost them. Does anyone know do you guys understand what's going on these days? And it's getting worse and worse and worse. And now only patients who could afford it can get that care. The whole point of insurance is to reimburse it. But they're taking all this money and putting it somewhere else. And rather than reinvesting into the people that put that money into that company, into that insurance, people pay for that insurance. That money needs to go back to them. And it's not. So, oh man, obviously you can see this gets me really worked up about it. I wish I had more people on this project. I need to find more people that are passionate about patient care because the answer is a new insurance company. I need someone to help me with this endeavor. I wish I had more capital to put towards it, more time. I could do it. We could do it. I just need a team that I could be having a meeting with, I don't know, once a week, once a day in the background. I have the algorithm. I created the algorithm with ChatGPT. I know how to do this. And we would refine it and work on it with the subscribing dentists that take this insurance over time to make it better for them and make it better for the patients. It would be a completely transparent, number one. And number two, all the money that goes in is like 95% would go out because we would use AI to eliminate the administrative costs. And the dentists on the board of this, the executive board, would not take a salary. It would be fully nonprofit. That's how insurance companies need to be. It needs to be self-sustainable. Anyway, God, you see how passionate I am over this. I really want to see things get better in dentistry. And sometimes I feel like we can't. Pat the dentist, I got a D in OChem. What's up, Pat? Dude, we were just talking the other day. I got a D in OChem in undergrad, 2 Ds for DDS. I only got 1. So guys, that's really important to include here. It's really important to include here, guys. You can get subpar grades some here once in a while. Obviously, you don't want to minimize. You want to minimize them, and I'm not supporting that, right? But yeah, just don't stress out too much, you know? Pat's the dentist said, yo, and then he said care notes. Yeah, I want to talk about care notes. I've been using it every day in the practice, you know? That's the truth. Pat the dentist said my hand skills are 4 out of 10. Don't say that. Come on, Pat. I'm sure that you're selling yourself short there. Just like I sell myself short in other areas where I need to be proud of. Anyway, FunnyClipz. Can you decide never to work in a hospital as OS and just do private practice implants and extractions? Yes, you can. Ethan McFarland, however, the board certification, to be a true board certified and qualified oral surgeon, they want to see that you have hospital privileges. Yeah, but they're not reinforcing that. Like, for example, on Long Island, most of the hospitals don't pay you to take call. Like, why? What? Free work. I'm not really interested in doing free work like that, especially in like doing actual surgery, taking call. I'm not interested in doing that for free. I'm just not. And, you know, surgeons shouldn't have to do free work. You put all this time and effort and tears and blood and sweat and years and tuition payments to get to this point. I don't think we should be accepting such a circumstance, you know. Ethan McFarland, 500, studying for my PAR exam tomorrow. At my dental school, we combine all of our classes into one exam. Oh, why would you do that? That's not a good idea. I don't think that's a good idea. I really don't. But good luck, Ethan. That sounds like it sucks. You combine at your dental school. What dental school are you going to, Ethan? Ethan, tell me what dental school you're at. I'm going to try and catch up with the chats here. Dylan G. Dental said, did any other specialties interest you in dental school? Some kind of did, maybe here or there. No, but no, it's really just oral surgery in general. Yeah. Dorsa followed the life creator. Thanks, Dorsa. Thanks, friend. Squiggly said, hey, Doc, what are your qualifications that you recommend for someone wanting to apply to OMFS residency? Like grades, research experience. Grades, it's going to be your experience, your personality, your character. I can't harp on character enough. I really think character plays a good part of it. You know, you want to spend time at these externships so they can get to know you and you can get to know them. Your CVSE score, that's another thing, okay? Jen Marie said, any advice regarding implants? I had hardware in my hand and my body didn't like it. OS mentioned my body might reject the implants too. They might. Unfortunately, you know, titanium is one of the most biocompatible metals, right? But sometimes certain people, they just reject everything. It's interesting. They start to develop this really severe periodontal defect around the implant. You want to make sure that socket's clean and to give that a best shot. But you know what I mean? It's so variable. It's really tough. The TikTok dentist said limits of wording on here. Yeah, I'm sorry about. Yeah, I know TikTok limits the wording. So procedures that count toward graduation supposed to be on people now being done on typodonts. Yes, I see what you mean. Yeah, there's a lot of that going on. I don't know. I don't know what to say about that. I know exactly what you mean. I don't know. Mine was on typodonts. My CDCA exam that's accepted in like most of the states to be a practicing dentist was done on typodonts. But mine was the COVID year too. So that's also tough, right? Because it was COVID that initially made it on typodonts. So, and then they I don't know if maybe they went back. I don't know. Coffee Monte Cristo said, why insurance company act like this? Jesus. Yeah. Why do they act on that? It is such a joke. Jen Marie said, dental insurance is such a joke. 1,500 max. Root canal treatment is 5 times that amount. You're right. And Jen, 1,500 maximum was created in 1970. They haven't increased it since. And isn't the whole point of an insurance company to match inflation as inflation goes up? And 3% is underscoring. Let me tell you, the average inflation every year over the years, a little bit more. I'm telling you, probably a little bit more than 3% every year. It's a nice estimate, but isn't insurance supposed to track that to allow people in a broader population to get the dental care that they need? Why aren't they doing it? Why aren't they doing it? We need to create a new insurance company, and I'm ready to go. I will help with this. It's a project. This is like my life purpose. I want to see healthcare professions get better. I'm in dentistry. I want to do it in dentistry. I want to start in dentistry. I think the key right now, the fundamental cause of what's ruining healthcare is the lack of insurance reimbursement, lack of provider support, lack of patient reimbursement, and now inaccessibility. They have insurance and they can't even get a cleaning. It's ridiculous. P, can I shadow you? Yeah. P, you can come shadow me. Just if you'd be so kind, let me finish my board exam because I am trying to squeeze a little bit extra time out of the day to do that, to study for that. And I take that in I think it's the first week of February. So after that, yeah, let's set it up. After that, reach out to me after that, please, though, so I can, focus a lot on that until then. Dia said, what do you think of High Point University not requiring the DAT, or DAT won't be required in the, I think you're saying full curriculum? Yeah, I don't know. I do like the idea of creative concepts like that in order to be able to, step out from the norm. Right? Wow, I lost my spot. Here we go. To step out of the norm and create something different, a new dental school, a new thing. Creating new dental, by the way, why is it called High Point University Workman School of Dental School? Because it's coupled with a DSO. It's literally funded by a DSO to open that dental school. And that's the fact. I think that's textbook conflict of interest. I really think it is. And you have to understand, the dental schools make more money off the dental students nowadays than off of patient care. So it's about, if they don't require the DAT, it's a new university, it's something different that's going to attract people's attention to go there and become a dentist over other schools. But what's the point? Like, the point is to become a dentist. The school's point right now is to maximize how many people per year they can take tuition money from. That, just keep that in the back of your mind. Keep that in the back of your mind. Victor, is a shadow on a tooth a cavity? Could be a stain, could be coffee, could be tea, could be, there's so much. It could, a shadow on a tooth a cavity. It might be, it might be staining from antibiotics. Maybe you had tetracycline as a kid. I don't know. There's so many things that it could be. TikTok dentist said at Dia, terrible idea. Mandu said, what do you think of High Point University in North? Oh, yeah. You said that. Jen Marie said insurance should be the full body care, not 3 different ones. Wait. No. I don't know about that. Because now if everything's covered under one insurance, then why do we have dentistry as a profession? Why do we have ophthalmology as a profession, your eyes? Why do we have other parts, the medical side of healthcare, the surgical side of healthcare? I don't know if I agree with that. You know why you don't want to do that is because then the insurance company can say, oh, well, now you're going to have a $15 maximum for the year for all your medical needs. Do you want that? Does that make sense, Jen? This is what they do. They try and do that stuff in order to manipulate patients more. They get more profit out of that. You do not want that. You want to maximize how much money you get per everything you need. In fact, we should probably separate it even more. We should make separate insurance for the feet. We should make separate insurance for, I don't know, the heart. I don't know. You see what I'm saying? Now, look, I don't know if that's the way we do it, but this is an argument that I'm making. It's an idea. You see what I'm saying? We need to create other ideas to make it better. But consolidating into more is just going to allow the insurance companies to leverage their manipulation and powers over us more. Dia said, at the TikTok dentist, I honestly don't think DAT would really help. Jfcjdbddj said, I've seen your CBSE dissection video and I had a question. Would you recommend starting UWorld? I would recommend starting UWorld. I would recommend starting UWorld and doing things section by section. Yeah, I mean, you're several months out. I think it's a good idea. And then if you could get through it, do half of it on your second pass. Go to Amboss, and you could always come back to UWorld after, right? It takes several months to study for that. Hey, Dad, how's it going? I'm just on a live right now. How was fishing today? Good. Excellent. Yeah, I'll talk to you more about that in a little bit. JFCJD said, untimed in tutor mode early on. Oh, for untimed tutor mode, that's for your second pass to UWorld. Okay, remember, I said that's your second pass to UWorld in that dissection video. I wouldn't do that early on necessarily, right? Just do them section by section. Do the topics by topics first. Akiba said, where did you do residency? I was at NYU and Bellevue in Manhattan, New York. Squiggly emoji said, if I have a dentistry diploma in another country with medium level of education, can I work in the US? You'd need to repeat some years in dental school in the United States first before you can apply to work here. Victor, an MD in India only needs 6 years to be an MD, including bachelor's, and it costs $850. Training as an RN. Wow, Victor, that's pretty interesting. Ethan McFarlane 500 said, I go to University of Tennessee or Texas Health Sciences Center. Is that Tennessee? UTH, that's Tennessee in Memphis. Got it. So you're going to UTH, that's the Tennessee Dental School. Is everything all right over there? Oh, okay. All right. Let's see. Tennessee Health in Memphis. 8 classes on 1 exam. Yeah, that's a lot, Ethan. That's a lot. 3 weeks of info. That's a lot to be squeezing into 1 exam, Mr. Klee said, are you officially an attending? Technically, yeah. I'm an attending now, but I work in an office. I work in a private practice in Melville. It's called All County Oral Surgery. Danny said, residency interviews coming up. Congrats. Did most guys wear full-on suits to the interviews you went? Yes. Now, remember, my year was the COVID year, so we were entirely virtual. We were entirely remote on our interviews. Yeah, so that was, but yeah, I wore a full suit for my interviews and stuff. I wasn't going to take the chance at them telling you, like, stand up, let me see that you're wearing pants, and then ends up, I'm like in my underwear, my pajamas. That would not be a good look. So yeah, definitely wear your full suit and everything, okay? The squiggly emoji said, at Victor Howe, if I have dentistry degree, what does that have to do with RN? What? I'm not following. Melissa Mahan said, kudos. Healthcare really needs to be changed. It does. And I don't think the changes that they're going to try and make are going to be beneficial for patients or providers. If I'm being completely honest, they're going to harness AI to maximize profits and maximize manipulation of patient payments into the system and less reimbursement out to providers and the patients that got to care of themselves. It's what's going on. We're seeing it already. Ahmed said, what's your opinion? Should I join in dentistry or medicine? Well, I don't know. What do you like better? You know my opinion. I went into dentistry for a reason. I don't know what your interests and passions are though. My Chips said I received an interview invite from Harvard. Any advice? I'm a first gen college student. Cool. First gen college student. That's great. Congrats. But it's your scores, your personality, your experiences that's going to differentiate you from other applicants to Harvard. Excellent. Harvard's a great dental school. They have excellent match placement into specialties year after year. That's great. That's great. Makiba said, LOL, I'm doing virtual interviews soon, and I thought the same thing about being asked to stand up. Yeah. Yeah, I mean, I know of Dr. Wynn at Stony Brook used to ask dental students this on those virtual interviews. He would ask the boy dental students to stand up and make sure that they were, yeah, that's a true fact. That's how I know that. Jen S. or Lulu said, follow the live creator. Thanks, Jen. I appreciate that. What else we got? All right, guys, that's it for today then. That's all the comments in the chat. And this is TikTok Live number 76. The top 5 people that stayed on the live the longest, I'm going to give you guys a shout out in the caption of podcasts on YouTube and the podcast channels. All right, so you guys are going to get a shout out. So thanks so much for coming on. Oh, Jfcjdbddj followed the live creator. Thanks, man. Thanks, friend. And I'm going to try for next. I don't know if I'll make Sunday, maybe Saturday, maybe Monday next week. So we will see. Makiba, follow the live creator. Thanks, Makiba. All right. I'll be giving you top 5 guys, shout outs, guys and girls. All right, friends. Wish you a great week. Let's make it a good one.